Hello and welcome to Health Matters on Channels Television. I am Yomi Otaigbe. Every part of the body is important to the overall well-being of an individual, but the eyes, more than any of our sense organs, help us navigate the world around us. So let's look into how to make our eyes stay in a healthy state for as long as we live. To tell us more about eye care and how to prevent visual impairment, I have with me in the studio a consultant ophthalmologist with Viewpoint Specialist Eye Center, Lagos, Dr. Olaoluwa Amusan. Thank you so much for being here.
It's my pleasure, ma'am.
Thank you. And let me also remind you that in the course of the program, you will have the opportunity to make your contributions and ask the doctor questions concerning the eyes. The phone number to call is 0808 054 2233. The lines will soon be open, and you can also send your tweet to CTV_YomiO. Doctor, care of the eye. The World Health Organization estimated that over 200 million people have visual impairments. What's the burden like in Nigeria?
Nigeria is quite very high in Nigeria. In fact, it's one of the highest around the world in Nigeria. Particularly in Africa, we are the highest population in Africa. So we have the highest burden, to speak.
Between 180 and 200 million people, depending on who is quoting the figures.
Yes. And for most of these visual impairments, we have cataract taking a large burden of it in our environment. Whereas we have other things like glaucoma taking under huge burden, and then refractive error and other causes of visual impairments among us.
So you say cataract, glaucoma,
refractive errors, age-related macular degenerations, and other causes.
So those are the common,
Yes, but mostly we have cataract, glaucoma, refractive error.
Okay.
Most times.
So with this burden, tell us about some of those things that could bring about visual impairment, the causes, depending on, what type of eye disease we're talking about.
Well, usually with age, which is one very common thing with us, with age, we tend to have visual impairments, particularly for cataract and glaucoma. Injuries factors for them is the age. Now, with the age, above 40 years, for glaucoma particularly, we have this increase at which people tend to have increased glaucoma. Then for cataract, so above 50 years, the rate at which cataract occurs is very high. And the other ones too, so age is number one on the list. Let's take going now to individuals now. For example, cataracts. Age is a factor, a very big factor. In fact, we compare it to having gray hair. Usually, if we have somebody who is older, they will likely have gray hair. So, the same occurs too in the eyes.
Okay, before you continue, just for our viewers to understand what cataract is, could you just explain that?
Okay. In the eyes, we have different parts of the eyes. In the eyes, we have what we call the lens in the eyes. It is usually very clear. However, as we grow older, we tend to have some changes occurring in the lens. It becomes whiter, just like the gray hair that we have on the hair. With that, we have reduced vision due to that opacification of that lens. And that is cataract.
Okay, and what we have on the screen right now, someone's been the eyeballs, looking into it right now. Is that how to find out, if glaucoma is there? This is just visual screening, I guess.
Yes.
For this. But, okay.
The first thing to do is to check the visual acuity of these patients. And that is what was being done in the first picture there. Vision, to what extent this person is seeing is what is first of all being done. The visual acuity is checked initially. Now, later on in the picture there, you saw someone shining a pen torch, a torchlight into the person's eyes. That way we can, to some extent, see the level of clarity of the lens to see if there's cataract there. It is quite advanced. You can easily pick it up with the pen torch or with the torchlight. But in some instances, you can have to use some machines in the eye clinic to check what the level of the cataract really is.
Okay, so cataract is the one that's got the white covering on the black spot in the eye.
Exactly.
Okay, so you were talking about age being a factor to having some of these visual impairments. What are the other factors?
The other ones are inflammation or infection of the eyes. And we have trauma, which is quite very common today, particularly in the lower age group, below 50 years. I said mostly it is 50 years and above for cataract, age-related. For younger ones, trauma particularly in our schools, where we have children being beaten by teachers with canes. Mistakenly, the child tries to evade the cane and it enters into the eyes. We have quite a number of that coming up.
Okay, that will fall under trauma.
Yes, under trauma,
okay.
yes.
Okay, and perhaps those who also slap,
very true.
on the face.
That occurs also too, very true. So inflammation or infection could cause redness of the eyes. Sometimes if you have people who have redness of the eyes, that too could cause cataract. Then we have drugs also too. Probably drugs, some of them could cause cataract. Then we have women too who tend to lighten their skin, bleaching. Mm-hmm. So these drugs contain steroids, yes.
Skin lightening, like
yes. Many of these creams contain steroids. And those steroids can cause cataract also too.
They go through the skin.
Exactly. They affect all body parts. And some of it actually cause these changes in the lens to cause cataract. So people who bleach are at a higher risk of having cataract also too.
Mm. Okay, is there any other, perhaps, the kind of diet that we take that could be injurious to health? Some people have mentioned if you take too much of gari, which is made from cassava. But let's see, Lanre is on the line. Hello.
Hello, good morning.
Thank you for joining us.
Yes. Good morning, doctor.
Good morning.
Yes, sir. I just want to find out about eating gari, especially gari debu gari. I'm so much in love with it that every day I take it. I can't sleep without taking gari debu. I want to know if there's any effect it does to the eyes.
Okay, thank you, Larry. Okay, so, some people are also, on that table that Larry is shaking this morning.
Very true. Well, so far we've not found